Over 65? Never ignore. These 4 changes in your walking. The way you walk can change before you notice anything else is wrong. A shorter step, a foot that starts catching the floor, a new need to touch the wall, or one side of the body moving differently may seem like ordinary aging. Sometimes it is a temporary response to tiredness, pain, or an awkward pair of shoes. But sometimes your walk is giving you an early warning that deserves attention. Today, we're looking at 4 changes in walking that adults over 65 should never simply dismiss. I will explain what each change can mean, what you can check safely at home, when to book an appointment, and when the change is urgent enough to call for emergency help. The 4th change is the most time-sensitive, because waiting to see whether it passes can cost valuable treatment time. Walking is not controlled by the legs alone. Your brain chooses the direction. Your inner ears help with balance. Your eyes judge the floor and obstacles. Nerves carry messages. Muscles produce force. Joints allow movement. The heart and lungs deliver oxygen. Even attention matters when you turn, cross a road, or talk while walking. That is why a change in walking can have many causes, and why it should not be diagnosed from a video. Here is a useful starting point. Ask yourself, is this normal for me, or is it new? A person who has walked slowly for years because of arthritis is different from someone who suddenly begins dragging a foot. A gradual change over several months is different from a change that appears in a few minutes. Timing matters. So does whether the change is getting worse, causing falls, or arriving with pain, weakness, dizziness, numbness, chest discomfort, or shortness of breath. Before the first change, think about your own walking. Have you become slower, started shuffling, felt less steady, or noticed that one side moves differently? You can share just one word in the comments. Your answer may help another viewer realize they are not alone. The first change is a noticeable loss of speed, step length, or walking endurance. Most of us do not measure walking speed. We notice it in ordinary life. The family walks a little ahead. Crossing the street feels more rushed. A familiar route requires a rest. You take shorter steps without meaning to, or you stop going somewhere because the distance now feels too demanding. Some slowing can happen with age, especially after illness, hospitalization, inactivity, pain, or a period of poor sleep, but a clear decline should not be written off as just getting older. Slower walking can reflect reduced leg strength, joint pain, fear of falling, poor vision, medication effects, anemia, or problems involving the heart, lungs, nerves, or brain. Sometimes the reason is simple and treatable. The important step is finding it. Notice the difference between choosing to walk slowly and being unable to walk at your usual pace. If you can speed up comfortably for a few steps, that is different from feeling that your legs will not respond. Also notice what limits you first. Is it knee or hip pain, heavy legs, breathlessness, chest pressure, dizziness, general weakness, a racing or irregular heartbeat? Each pattern gives a clinician useful information. Try this safe observation, not as a diagnosis, but as a way to describe the change. Choose a familiar, level path inside your home. Wear your normal supportive shoes and use your usual cane or walker. Have someone nearby if you are unsteady. Walk at your normal pace and notice whether your steps are even, whether you can turn without grabbing support, and whether you become unusually breathless. Do not challenge yourself to walk faster, and do not perform the test alone if you have recently fallen. You can also compare function rather than numbers. Can you still walk from the bedroom to the kitchen without stopping? Can you manage the route to your mailbox? Can you rise from a chair and begin walking without several attempts? If these tasks have become harder over weeks or months, write down when the change began and what symptoms come with it. Here's the part many people miss. Resting more is not always the safest answer. When people become worried about walking, they often move less. Then the legs become weaker, confidence falls, and walking becomes even harder. This can create a cycle. Less movement, less strength, more fear, and even less movement. The solution is not to push through warning symptoms. It is to find the cause and keep moving at a safe level. A doctor may review your heart, lungs, blood count, medicines, joints, strength, and nervous system. A physical therapist can assess how you rise, turn, balance, and place your feet. Then create exercises that match your ability. For many older adults, a mixture of walking, strength work, and balance activity supports mobility better than walking alone. Seek urgent help if a new loss of walking endurance comes with chest pressure, severe shortness of breath, fainting, cold sweating, or pain spreading to the arm, back, neck, or jaw. Those are not symptoms to walk off. The second change is shuffling, toe catching, foot slapping, or difficulty lifting the front of the foot. You may hear your slippers scrape. The toes may catch on rugs. One shoe may wear differently. You may lift one knee higher to clear the floor, or the front of the foot may slap down after the heel lands. Family members sometimes notice this before the person walking does. A shorter, more cautious step can appear when someone is afraid of falling or has painful hips, knees, or feet. Poorly fitting shoes can also change the way a person walks, but persistent shuffling or repeated toe catching can point to weakness, reduced sensation, nerve problems, or a movement disorder. A foot that cannot lift normally is often described as foot drop. Foot drop is a sign, not a diagnosis. It can have causes involving a nerve in the leg, the lower back, muscles, or the brain. Numbness deserves special attention. If the soles of your feet feel like they are covered by thick socks, even when they are bare, the brain may be receiving less accurate information about the floor. Peripheral neuropathy can cause numbness, tingling, burning, weakness, or loss of position sense. Diabetes is one possible cause, but it is not the only one. Vitamin deficiencies, alcohol use, certain medicines, infections, autoimmune conditions, and other disorders can also affect nerves. Small shuffling steps may also occur in Parkinson's disease and some other neurological conditions, especially when they appear with stiffness, slower movement, reduced arm swing, tremor, difficulty starting, or a feeling that the feet are briefly stuck to the floor. Shuffling does not prove Parkinson's disease. Arthritis, weakness, fear, and many other conditions can look similar. It does mean that a proper examination may be worthwhile. Here is a simple observation. While seated safely, can you lift the front of each foot toward the shin? Do both sides move about the same? Can you tap each foot several times? Do not force the movement, and do not use this as a medical test. If one side suddenly cannot lift, or if weakness is new, contact a clinician promptly. If it began suddenly with facial drooping, arm weakness, speech trouble, severe dizziness, or vision change, call emergency services immediately. Check the environment too. Remove loose rugs or secure them. Make sure hallways are well lit. Avoid backless slippers that slide off. Shoes should fit, hold the heel, and provide a stable sole. If a cane or walker has been recommended, use it rather than saving it for bad days. The correct device can improve safety, but the height and technique matter, so professional fitting is valuable. Do not respond to foot catching by practicing exaggerated high steps near stairs or furniture. Until the cause is assessed, choose clear, level surfaces and use support. A clinician may examine strength, reflexes, sensation, footwear, the spine, and the pattern of walking. Depending on the cause, treatment may include physical therapy, an ankle brace, pain treatment, medication review, nerve evaluation, or management of an underlying condition. Now pause for a quick comparison. Slowing means the whole journey is becoming harder. Shuffling means the feet are not clearing or placing themselves as they used to. The next change is different again. The legs may have enough strength, but the body no longer feels reliably centered. The third change is new unsteadiness, veering, difficulty turning, or reaching for furniture. Perhaps you walk straight in an open hallway but wobble when you turn. You touch counters as you pass. You feel pulled to one side. You become unstable in the dark, on uneven ground, or when someone asks you a question while you are walking. You may not have fallen, but you have started planning every route around something you can hold. Balance is a team effort between vision, sensation in the feet and joints, the inner ear, the brain, and muscle reactions. A problem in any part of that team can make walking less steady. Causes can include medication side effects, low blood pressure when standing, dehydration, poor vision, inner ear disorders, neuropathy, muscle weakness, infection, heart rhythm problems, and neurological disease. Dizziness is an important clue, but the word can mean different things. Does the room spin? Do you feel faint, especially after standing? Do you feel as though you are on a boat? Or are your legs simply unreliable? Describing the sensation clearly is more helpful than saying only, "I feel dizzy." If unsteadiness appears after starting a new medicine or increasing a dose, do not stop it on your own. Ask a doctor or pharmacist to review the full list, including sleep aids, allergy products, pain medicines, blood pressure medicines, and supplements. Several products that seem harmless separately can combine to cause drowsiness, low blood pressure, or slower reactions. Vision and hearing also deserve attention. An outdated glasses prescription, cataracts, poor depth perception, or difficulty seeing contrast can make steps and curbs harder to judge. Inner ear problems may produce spinning, nausea, hearing changes, or ringing. Regular vision and hearing checks are not separate from fall prevention. They are part of it. Here is the catch. Many people wait for the first serious fall before mentioning balance. But grabbing furniture, avoiding turns, or nearly falling are already useful warning signs. Tell your clinician about near falls, not only falls that caused injury. A fall risk assessment may include checking blood pressure while lying and standing, reviewing medicines, examining vision and feet, and observing strength, gait, and balance. A physical therapist can teach safe turning, stepping, strength, and balance strategies. Evidence-based programs may include exercises such as Tai Chi, but the right choice depends on your current ability and medical conditions. At home, create a wider safety margin. Improve lighting, especially between the bedroom and bathroom. Keep frequently used items within easy reach. Install secure handrails where needed. Rise slowly from bed or a chair. Keep a phone or alert device accessible. These changes do not mean you are giving up independence. They protect it. If clear, practical guidance for life after 60 is helpful to you, subscribe to Herbi Diet so we can keep learning together. And now we come to the fourth change, the one where timing matters most. The fourth change is a sudden or clearly one-sided difference in walking. One leg begins to drag. One foot turns differently. One arm stops swinging while the other moves normally. You suddenly lean or fall toward one side. The change may be accompanied by numbness, weakness, facial drooping, trouble speaking, confusion, double vision, severe dizziness, or loss of coordination. A sudden change like this can be a sign of stroke or a transient ischemic attack, sometimes called a mini-stroke. Even if the symptoms improve after a few minutes, emergency assessment is still needed. Do not wait for the next morning. Do not drive yourself. Call your local emergency number and note the time the symptoms began, or the last time the person was known to be normal. A helpful stroke reminder is be fast. B is for a sudden balance problem. E is for sudden eye or vision change. F is for face drooping. A is for arm weakness. S is for speech difficulty. T means it is time to call emergency services. Not every stroke looks the same, and a sudden walking problem may occur with or without all the classic signs. One-sided change is not always a stroke, especially when it develops gradually. A painful hip or knee may shorten one step. An old injury may cause a limp. A pinched nerve can weaken part of a leg. Parkinson's disease may reduce arm swing more on one side early on. Foot drop may affect one side. But new asymmetry still deserves evaluation because the cause cannot be identified by appearance alone. Watch for progression. Is one shoe scuffing more each week? Is one arm held stiffly? Are turns becoming more difficult? Does the body lean? Are you developing numbness, back pain, bladder changes, or repeated falls? A clear video of your normal walk, recorded safely by a family member, can sometimes help a clinician see a pattern that is less obvious during a short appointment. Do not walk without your usual support just to make the video. There is another urgent pattern worth knowing. Rapidly increasing weakness in both legs, especially with new numbness, severe back pain, loss of bladder or bowel control, numbness around the groin, or difficulty breathing, needs emergency assessment. It is not something to treat with a home exercise video. Now let us turn these 4 warnings into a calm plan. Today, notice your walking without criticizing it. On a safe, familiar surface, observe your pace, step length, foot clearance, balance, turning, and symmetry. Use your normal shoes and mobility aid. Ask someone you trust whether they have noticed a change. Many families avoid mentioning walking because they fear causing embarrassment. A respectful question can protect independence. This week, write down when the change happens. Is it only after sitting, worse in the dark, related to pain, present before or after medicine? Does it improve after several minutes or worsen with distance? Have there been falls or near falls? Bring the list of medicines, including over-the-counter products and supplements, to an appointment. Then ask for the right kind of help. A medical evaluation can look for causes. A physical therapist can assess movement and build a safe plan. An occupational therapist can help make daily tasks and the home safer. A podiatrist may help with painful feet or footwear. Vision and hearing professionals may identify missing pieces. The solution is often a team, not a single miracle exercise. While waiting for assessment, do not stop moving completely unless a clinician tells you to rest. Choose safe activity within your ability. The general goal for older adults includes aerobic activity, muscle strengthening, and balance work, but the starting point may be a few supported minutes. Some movement is better than none when it can be done safely. Never let pride keep a cane or walker in the cupboard. A mobility aid is not a symbol of decline. Used correctly, it may allow you to walk farther, participate more, and reduce fear. At the same time, borrowing someone else's device without proper fitting can create new problems. Ask a professional to check the height and technique. The strongest message today is not that every unusual step means disease. It is that change carries information. A slower pace can reveal reduced capacity. Shuffling can show that the foot is not clearing. Unsteadiness can expose a balance problem before a fall. Sudden or one-sided change can signal an emergency. Which of the four will you pay closer attention to? Slowing, shuffling, unsteadiness, or one-sided change? Tell us in the comments. Subscribe to Herbi Diet for respectful, evidence-aware guidance about staying active, steady, and independent after 60. Share this video with a partner, sibling, friend, or caregiver who has recently said, "I do not walk the way I used to." A useful next topic would be how to make the home safer without making it feel like a hospital, because small changes in lighting, footwear, floors, and support can prevent a walking concern from becoming a serious fall. This video is for general education and cannot diagnose the cause of a walking change. Seek professional advice for any new, progressive, or concerning change. Call emergency services for sudden trouble walking, sudden loss of balance, one-sided weakness or numbness, facial drooping, speech trouble, sudden vision change, fainting, chest pressure, or severe shortness of breath. Your walk is part of your independence. Paying attention to it is not fear. It is wise self-care.